Hello everyone, I am back with another video, and today we are going to learn how to do Trach Care. So there are many different Trach Care kits that you can use, but they all pretty much contain the same amount and type of supplies. If you don't have these Trach Care kits, you can always build your own. Another important step before we start our trach care is to see what type of trach that your patient has, to also see if they have an obturator at the bedside for emergency purposes, to see if they have a pass-C-mirror valve, as well as extra inner cannulas and what type, such as extra long, like this one. And always protect yourself. Don't forget your syringe to make sure your cuff is deflated, as well as an ambu bag to ventilate your patient in case of emergency purposes. Now let's get started. Introduce yourself to the patient and explain to them what you're in the room for. So after you wash your hands, you're going to carefully inspect the trach site. We're going to look to make sure we know what size trach the patient has. We're going to carefully check to see everything is connected and in place. Check to see that the cuff is deflated if they are not on a ventilator, as well as see how much oxygen and humidity this patient is on at the current time. Also, make sure that your suction canister is turned on and ready to go. We want to make sure that all tubing is connected and in place, so that way when we suction our patient, we don't have any issues. So now I am going to open up my Trach Care supplies kit. I have it on a bedside table, so that way it is close to my patient. I dumped out all the contents onto that sheet there that comes with the Trach Care supplies kit. And now I'm going to open up a bottle of sterile water and pour that into my tray. Now that I feel like I have enough water in my tray, I'm going to review to make sure I have everything. I'm going to make sure I have my exam gloves set aside, my 14 French suction catheter, cotton swabs, gauze, pipe cleaners, a towel to place over my patient so I don't mess up their gown, a trach brush, as well as a trach dressing. And it looks like I have all my supplies ready and out to go. So let's walk through this together. I'm moving my bedside table out of the way a little bit, but still close in reach, because remember, you're not always going to have a partner when doing trach care, so you want to make sure that you have everything you need by your side. So I'm checking my site again, making sure that everything is in place, and I'm going to loosen up and take off this trach collar that my patient is on right now. Please keep in mind that if they are on oxygen, you have to be mindful of the time that you're spending taking them off that oxygen to clean their trach. Now I'm going to cover them with this towel because I don't want my nurse mad at me. I'm not messing up this gown, okay? I'm always going to make sure that my pilot balloon is in sight. That means I'm going to make sure that it's not hidden or tucked in under anything, because remember, whatever happens to the pilot balloon is what happens to the cuff. So I always want to make sure that my cuff is deflated during this time and I'm not occluding my patient's airway. There goes my tray with the water again. I'm going to take this nice sponge here, soak it all up, and make sure I use it to clean my trach site. So this means I'm going to get behind the neck and make sure I'm getting anything that's back there. It could be old dried up blood, could be anything crusty, some dirt back there. So you really want to make sure you get in there and clean it up nice and good. You also want to get the trach itself, clean that up as well. A lot of times patients will still have sutures in, so you want to be mindful of that. And you want to also try to hold your trach in place if you don't have the trach ties there already, to make sure that you're not dislodging the trach as you clean. But really make sure that you clean up really good, guys. Now, let's pull out those exam gloves. So we talked about this in lab. You have one clean hand and one dirty hand. Instead of taking my gloves off and putting both of these gloves on and confusing myself, I already know that they're two different colors. So I'm just going to put one exam glove over one of my hands, so that way I can determine which one is clean and which one is dirty. So now I'm checking the suction on my suction tubing to make sure I'm good and ready to go. And then I'm going to pull out that 14 French suction catheter that I showed you earlier, and we're going to use that to suction our patient. What I want you to know is depending on the trach size as well as the age, depends on the type of suction catheter and size you're going to use. So in pediatrics, for example, you're not going to use a 14 French suction catheter. So be mindful of that before you're just shoving anything down someone's trach. You could cause a lot of trauma. So I'm grabbing my suction catheter with my clean hand and I am wrapping it around my glove, making sure I do not touch it with my dirty hand. I'm going to connect with my dirty hand to the suction tubing and prepare to unravel and suction down the trach. So now that my suction catheter is connected, I'm checking my suction and I'm going to grab a saline bullet. This is going to be used to loosen up any mucus down there so that way your patient can cough it up and we can suction it up. Now be careful, you're in the sputum zone, so they may cough and you may get it. And boy, have I seen some pretty impressive sputum fly across the room and up to the ceiling. That's right, don't let it get in your face and don't get too close. Notice I'm keeping my fingers close to the numbers to make sure I'm not going too far into the trach. Remember, we're here to suction sputum, not poop. Many times there will even be a sign over the head of the bed that lets you know how far to go. 10 is enough for this patient. So now I'm going to clean out that suction catheter using that tray that we poured water into earlier. Before I go down a suction again, we want to make sure that everything is cleaned out and into the canister. You may also pre-oxygenate and monitor your saturations as you suction your patient. Just make sure you're not going too far or down too many times to cause trauma to them. So I'm going to get ready to take that nasty glove off and put it off to the side and continue on to the rest of our trach care. So I opened up a new inner cannula, the same size as the patient already has in. Whatever size trach the patient has will be the same size inner cannula that you put in. So I'm squeezing the sides of the inner cannula, taking that out while holding the trach down. We don't want to dislodge it. And now I'm introducing the new inner cannula inside. Here's a closer look of me putting in a new inner cannula. So now we're going to move on to trach ties. So as I'm opening this packaging, I want you all to know that you cannot cut your trach ties. So whatever excess that you may have, you must fold it over and tuck it in, but you cannot cut anything extra off. You want to measure around the neck and adjust the Velcro straps to what you need. While I'm doing this, I'm scanning the room to make sure that I have extra trachs at bedside. I need one that is the same size the patient has now and also a size smaller in case the trach hole starts to close up, when it is dislodged, I need to be able to push some sort of trach in there. So sometimes it even requires you to go down a size, but we need to make sure that we have an airway regardless. So remember, once you start taking these trach ties off, they may not have sutures. So keep that in mind and make sure you have all your emergency supplies, including your obturator, at bedside. So this can be a little tricky sometimes, making sure that you have everything in there, sliding it through, and passing it behind the neck. Holding the trach in place and making sure it's secure, I'm then going to take 2 fingers and place it underneath of the trach tie to make sure that it's not too tight and it gives the patient a little breathing room in there. Okay, we're good. Now let's get rid of this garbage. So out with the old and in with the new, we're going to add some new trach dressings. So this has a slit down the middle to allow room for the trach, and it is also double layered for protection, as well as thick secretions or whatever may be leaking out of the trach site. Just take your time and slide one part in at a time, even if you have to go to the other side of the bed to make it work. I call this the bow tie. Tired of hearing my voice? We're almost done. Next step, we're going to clean this trach collar. So I'm going to take some more water in 4x4s from my tray that I had earlier, soak them in it, and wipe that trach collar clean. Although we continue to explain everything that we're doing in this process, your patient is probably feeling some discomfort through it all. Reassure them that everything is okay and that you are all finished. Before I leave the room, I'm going to inspect my trach site one more time, make sure that everything is clean and connected. Oop, and don't forget this is an airway. What does that mean? We need to listen to breath sounds. If you mess with an airway, you need to check it before you leave the room. So pull out your stethoscope and make sure you have bilateral breath sounds.